Hi, I'm Dr. Onna Lo. Who here wants to be happy? Raise your hands.
Yes.
Who here wants to be healthy?
Yes.
Who here wants to be impactful in your work, your passion, and your potential?
Yes.
Right?
Yeah.
But honestly, how many of you drink your coffee in the morning, not because you love the aroma, the ritual, but because you're not the best self, you're kind of grumpy, and you're not really functional until you drink that coffee? Or how many of you are tired at 3 o'clock, you get that hit the wall thing and you need to wrap that cookie or that sugar fix? Or that you're finding yourself getting sick 3 or 4 times a year now, especially when you go on vacation? Or that you're noticing that your mind's not working as well. There's kind of like a fog. You're losing your keys. You're leaving your coffee on top of your car. Or that you're not finishing your task at work as well. Not only you notice, your boss noticed too. Or that you're actually noticing that your muffin top, your spare tie, is getting bigger and bigger and gaining that extra weight every year after you turn 35. Well, you're not alone. Turns out only 1 in 7 person feels completely refreshed every day of the week. 15% women are exhausted all the time, and 10% men are exhausted all the time. Depression, it's going to become the #1 cause of disability next year. And overweight, 2/3 of the population. We're in a sick time right now. So if you said any of the yeses to below, this talk is about you. Or I'm going to talk about a very wonderful functional medicine system that I've learned that will be really helpful, that will help find the root causes of a lot of what we're feeling. And I'm going to talk about the #1 cause of it that will be concerning to all of you and be relevant for all of you. Does that sound good?
Yes.
All right. So let me tell you a little bit about my own story. At the age of 12, I decided I want to become a doctor. I have parents I want to impress. I'm Asian. But I also have a passion. I do want to help people. So I decided to go into medical school. I got into medical school, the best one, an Ivy League at Brown. And when I finished medical school and started my first day with my white coat, going to my first appointment as this doctor, I was all proud. I thought that I had done really well. I know what to do to save the world, right? So I picked up this really thick chart and I flipped through it, and there was nothing really wrong with it. I couldn't find any abnormal labs, abnormal exam, but there was just a refill for 8 medicine, and the woman was only 35 years old. So I walked in, shaky really. And there she was, just a very tired, depressed looking woman. She was very pleasant, but as we got talking, she really struck me to be a very reasonable woman. Her name is Jane. She is a lawyer, but she couldn't work anymore. She got really tired after she had her kid, and then she started having all these irritable bowel symptoms. Then all of a sudden she started having all these autoimmune diseases. And then she had all these other abnormal symptoms of pain all over her place. And she didn't know what to do. The doctor, she's seen a few other specialists and gave her medicines for pain, for controlling the immune system. But she comes here today because she was just feeling tired. She told me that the doctor had told her everything's fine. Now the autoimmune disease is controlled because she's on this med. She's on all these other medicines, should cover her symptoms. She's depressed, but she's on antidepressant. She has problems digesting her food, but she's on acid medicines. Everything should be fine, but she didn't look fine. She looked desperate, and she comes in every month asking for the 6 refills for sleep, for pain, to get her more focused, to get her awake, because she really wants to go back to work. I didn't know what to do. I didn't think that I could help her. I looked at if all these specialists didn't know what to do, if all the medicines that we've prescribed her, she should be feeling better. We're specialists of medications. But I didn't know what to do. And when I walked out of the room, I knew that I was to find something else. I had to find something that would help me address that. So I became a yoga instructor. I became an acupuncturist. I got trained in osteopathic medicine. I learned about nutrition. I went everywhere because I want the answer. It's my passion. But not until I found something called the functional medicine, I thought that that was it. It was the one thing that really made sense and covered everything and helped me find the root cause of what's going on for any person. So I got trained in it, I learned a lot, and I started seeing patients in that way, and I've seen very good results. So now fast forward 10 years. I started working in corporations, such as Google or Genentech, big corporations that are leading, innovative, wanting their workforce to be happy, healthy, and sustainable. And I noticed that the same kind of patients. Turns out, even when I was working in all the other places before I got to start working in a corporation, I see patients with the same thing, right? A lot of you nodded your head when you say you're tired, you're mind foggy, you couldn't change your weight, you start getting all these diagnoses and you can't actually get better with medicines and doing what the doctor tells you, right? You were willing to do everything.
Yes.
But then nothing, there was just no good answer, right? So I started seeing patients in these corporations and I noticed a lot of burnout symptoms were coming in, similar to the ones I mentioned. But now I'm equipped. And now I notice that it's very simple. People are ready. When they're ready, they want the information, they want to know the system. So you guys want to know about this functional medicine approach?
Yeah.
So what functional medicine? It's basically a simple, clear system that looks at what you input, your environment, right? What you put into your body, food, water, air, what's in your cleaner, right? What's in the things that contains your food. You look at your genetics. You look at your pattern, your life, your stressors. You look at your nutrient, right? And then you see how it affects your fundamental systems inside. We call it the 6 pillars. It involves how you digest, how your body get rid of toxins. It involves how your hormones work, how your immune system works, how it fights, battles with illnesses and bacteria. And it also looks at how structurally you work. So when you understand what are the inputting stressors, the things that comes in, how it affects the trunk of a tree, the trunk that is important in creating the system, then you'll see what are the leaves and the branches that comes out, the symptoms. And so if you have this very clear system, when anyone comes in and they tell you, I have this 18 different things that spans different tree branches. I need to see a cardiologist. I need to see an ophthalmologist. I need to see an endocrinologist. You don't just say, go back to all of them. I don't know why they're related. With this system, you say, okay, let's look at the tree trunk. And then now let's go back to figure out what are the root causes and actually feed into them and make sure those are healthy. So now let me tell you about a patient that I just saw 2 months ago. She was, her name is Deborah. She's one of the managers, and she actually came in because she has severe IBS and she gained 40 pounds over the course of 3 months. She's just came back from having her 3rd child, and she is just about to have a nervous breakdown. She's not only freaked out about her weight, but she's also just in so much more pain. Her back hurts, she's sitting a lot, she's actually commuting this typical route between San Francisco to South San Francisco, the South Bay, every day, and then she's always just sitting in front of her computer having these virtual meetings. She's exhausted, and she can't show it to anybody. So what we did was simply help her understand the system, figure out what's the big stressors and the cause and the root cause, and then we just implemented some simple changes. We changed her diet. She was on a sleeping medicine. She was trying to drink her way to sleep better. So we try to cut down on the drinking. She was drinking 4 cups of coffee by 12 o'clock every day. So we kind of switch it around, get her the right nutrients so that she feels that energy. I didn't take away her coffee completely. I won't do that. Otherwise, you will not want to talk to me. But last week I saw her. She's lost 20 pounds. Whoa. She actually cut out 3 of her medications, mostly all of them pain meds and the sleeping medicines. Great. She's actually scheduling to have a tummy tuck because she felt like she feels so good. She actually want to continue and be proud of it. And that's what she wanted. She felt like it was going to be a persistent change. So how about I go ahead and tell you what is the number one cause that's most relevant to all of you, that's related to the root cause. Yeah? So we're going to start by just doing the lemon test. So everyone just relax your body. And just, you can close your eyes or you can just gently gaze down softly onto the floor. And what I want you to do is this. Take a few deep breaths. And what I want you to do is just imagine yourself in your kitchen, where the refrigerator is, see where the sink is, where the window is. And now I want you to open the kitchen refrigerator door, and I want you to go in and reach into there. There's a bag of lemons. Just go ahead and pick out one lemon. Pick the biggest one, juiciest looking one. Go ahead, close the refrigerator door, and take that lemon out and put it onto a chopping board and take a knife out. What I want you to do next is take that knife and slice the lemon in half. You will almost see the juice just squirting out, and you can smell the aroma. I can see some of you just licking already. Go ahead and slice yourself a small slice of lemon and pick that slice up and put it against your lips and just taste it. How many of you taste the lemon and feel like your mouth is puckering and that's salivating? You almost feel like you have a lemon in your mouth. All right, everyone open your eyes. So what just happened? The key insight is you just had a physiological response to an emotional, imaginary scenario, right? No lemon, no knife, no refrigerator, no kitchen. You just had a complete physiological response to an imaginary scenario, right? So turns out one of the biggest root cause for illness is stress, right? There's three main stresses. The top one is that of an emotional stress, one that is of the imagination. You imagine something that was kind of pleasant, maybe not for some who don't like sour, but imagine switching for a moment that it's traffic bumper to bumper. Someone just flipped you off. Imagine that your boss called, it's performance quarter review, performance reports are coming out, it's Q2. Your boss called and say, we need to talk. Does the gut feel like it just turned a little bit? Or tightening of your muscles, right? So all of these responses turns out related to the fight or flight from our ancestors' response, right? We come from a lineage of imagining there's really having a lion behind our back. And our body has this mechanism that allows us to have this very quick response that releases the right kind of neurotransmitters and this cortisol hormone into the blood so that you can respond quickly, right? Or your heart rate goes up, shorter breath, you can run really fast, your muscle tights, right? You don't want to have diarrhea when you're running, so you stop your digestion system. You don't really care about if you're thinking fast, you can do the math or pay tips or something, right? You want to be able to just concentrate all your resources to the running from the lion. So a chronic stress response is just exactly that. But in a real modern world where there's no lion, but there's just multiple imaginary lions, like deadlines, tasks, self-driven performance expectations, illnesses, colds, stiffness, pain, those things all actually aggregate into this chronic stress response. So over time, what happened is we drain out, we keep telling the cortisol, the stress hormone, to keep working. And over time, this hormone, which controls your thyroid, controls how well you think, controls how much you are going to produce hormones for your libido, hormones for making your period comes regularly, how much you deposit your fat to the right place. Turns out when you chronically stress that out, it just causes a big problem, and as a result, you become fatigued. You will hear words like adrenal fatigue. Adrenal is these two little organs on top of your kidney that's in charge of your stress hormones. Very important concept. So if you walk away, I want you to understand that this one simple root cause of having a chronic stress response is fundamentally affecting how you are seeing your hormones and your health, right? So imagine, now that you can see this very clearly, and knowing that the first one is emotions, knowing that emotions is the first stress, and then the second one is diet. Have you ever heard of being hangry? Yeah, or knowing someone who's hangry, having a partner who's hangry, or a partner who knows that you're hangry and always have some sweet things in their back just in case you blow up, right? And the third stress is actually from pain, from illness, from a disease, right? But imagine if you just have these clear systems that helps you really simplify the process so that you know how to expect it. You're all great high performers, right? Yes. So when you know what the problem is it a lot easier to handle it? A lot easier to participate in solving it, right? So can I share with you my vision? Yes. Yeah? So most of you here are working. Imagine 30% of your time in your life is going to be spent working, right? So imagine the magic that I have with patients in the room that I have with them using this functional medicine approach, helping them get better, helping them feel hope and feel like they can be happy, healthy, and get all the energy back to do what they love. Imagine that leading companies take on that vision and actually bring it to the corporate wellness program and able to use it and to be able to lift it from a fundamental level, to instill healthy foods, to educate the teams to actually make healthy choices, to pay attention to stressors, to acknowledge that fatigue, to certain habits are not necessarily because they're just behaviors, but there's actually underlying systemic cause. What kind of impact would that have? So if you know somebody in your wellness program or your wellness team of your company, or if you find this really helpful and you really want to bring this back to your company, I would love to have you connect me with them. I would sit down with them and talk with them the program that I have that brings this awareness, education, and specific system in the corporate world, and to use it so that you guys can become a happy, healthy, impactful people. Thank you.